thank you for taking the time to give us your story. And if you wouldn't mind sharing a little bit, what brought you in to see us at Michigan Center of Regenerative Medicine?
Thanks, Dr. Navady. I'm happy to share my personal experience of ongoing success with potential patients out there, existing patients. I came in with chronic knee issues, primarily inflammation of my MCL in both knees, and some associative degeneration in my cartilage in both knees as well. A lot of hockey playing and just, years of kickboxing sort of caught up with me. And so before going in for surgery, I looked at this as a preventative, regenerative option. Prior to receiving my procedures, I really had difficulty even just walking up a flight of stairs. So I'm a 50-year-old male, and I really felt like I was maybe 70 or 75 years old when it comes to my functional mobility. After the shots, within a month, I started to see some improvements, and now we're at 3 to 4, going on 5 months, and it's really given me the freedom to now go out and just return back from a family vacation where we went out to Cape Cod, and I was able to participate with my family in a lot of strenuous activities, bike riding, pulling my daughter behind me on a little piccolo, wearing backpacks, hauling things around, and doing that with the sense of security that I could keep up with my family and create some fantastic memories. Part of the procedures too was a super shot that I received. Both the knees, the right knee was a little bit more damaged and inflamed, and so Dr. Navady shot me with a super shot, and now both knees generally feel about the same, which is great. So I'm back in today for some additional follow-up procedures, now to elbow, shoulder joint, and my knees as well, and I'm here living proof to say that it's not only good science, but it also, the results can help change your life for the better.
I really appreciate you sharing that story. I'm sure that's going to resonate with a lot of people out there. If you could talk a little bit about the procedure, is there any pain associated with the procedure? How do we manage that pain, and just kind of the general experience with the staff here at the Michigan Center of Regenerative Medicine?
So the staff are super helpful, super knowledgeable, very relaxed atmosphere. The procedure itself is, I won't lie, it's discomfortable. I wouldn't say it's painful, but it's really uncomfortable. Getting needles shot into your body is not an ideal situation, but it's a lot less invasive than getting cut open for surgery and then potential follow-up problems with that. So level of pain really on the first day when you get the shots, when the liquid goes into your joints, it's just uncomfortable because your body's not used to that. Within 48 hours, that really starts to subside as it's absorbed into your body, and probably by day 3, I was at least up walking around and very mobile with no problems. And by the end of the first week, didn't really have any follow-up pain or issues. So if you can stomach that first 48 hours, you should be good.
I appreciate you saying that. It's always much more believable when you hear it from patients who have experienced it than just the physician saying it. And I greatly appreciate you taking the time to share your story.
Thanks.
Thank you.